Hey everyone, Dr. Luke Peterson here, physical therapist with the Knee Replacement Therapist. In this episode of the Need to Know Show, we're going to talk about the risk of loosening of your knee replacement. We're talking about months and years usually after knee replacement surgery. What are some of the causes and what are some of the red flags to look out for? Before I jump into that, be sure to hit that subscribe button and turn on your notifications to catch all of our videos related to knee replacement surgery, rehab, recovery, frequently asked questions, and much more. So first of all, let's talk about what are some of the reasons that your knee replacement can loosen. And when I'm talking about loosening, basically what I mean is the attachment of your implant, the metal or the plastic components of your implant actually come loose and kind of disengaged, disconnected from the bone that it's attached to. And obviously this is bad because it's going to lead to a lot of things that we'll talk about, and it in turn can eventually possibly lead to failure of your knee and your knee replacement, and we'll talk about what kind of some of the next steps are from there. So what can cause this loosening? Well, first of all, just excessive wear on the implant on your knee joint. Knee replacements tend to have a lifespan. Thankfully, this lifespan is getting longer and longer with proper management, proper surgical techniques, different types of implants, and the research that's coming out, minimally invasive and robotic type surgeries. All these things kind of together are leading to longer lifespans of these knee replacements in general. But they can undergo excessive wear and tear throughout the lifespan. Impact activities or even just regular activities, lots of walking, lots of movement, going up and down stairs, tends to lead to some excessive wear over time. The next thing is the possibility of an infection. And this can be really serious and something you definitely want to rule out. If you have any concern about that at all, definitely getting in touch with your doctor, having them perform some tests to make sure there isn't an infection of your knee replacement or your knee joint. Another thing is fracture. So a broken bone can lead to a failure of that connection between the bone and the implant again. That broken bone is not going to be sturdy, not going to hold tight with that implant. And that can sometimes occur with a fall, most often. Sometimes, if you twist or do something the wrong way, if you have relatively fragile or frail bones. Another option or possibility is poor alignment. So having poor alignment of the knee replacement can lead to kind of a poor fit. So it's a predisposition to possibly loosen a little bit easier or a little bit more likely than someone who has a good alignment and good fit of the replacement. And also there's things like technical failures. So maybe your cement didn't work and didn't adhere appropriately, the glue or the cement that's used to keep that implant to the bone. And also there's the possibility of having an allergic reaction to the components of your implant, and that can lead to inflammation, fluid, and loosening of the implant. So what can we do about this? And what do we have to look out for red flags of the potential for this? Well, if at all you're concerned, first of all, I would say definitely don't hesitate to contact your surgeon's office, get a hold of the nurse, get a hold of the doctor himself, him or herself, and talk it over and see what's going on a little bit. If they think that something's going on, then they'll probably bring you in for an appointment, maybe take some imaging, maybe do some tests, looking at the fluid, making sure there's no infection, and then you can rest assured if your knee is loosened or if it looks okay. So some of the signs to look out for are a new onset of excessive or debilitating pain or excessive debilitating swelling of the knee. This is, again, the big thing here is a new onset or kind of a rapid onset. So of course there's going to be pain after knee replacement surgery. Of course you're going to have some episodes of fluctuating pain as you recover over the weeks and months after surgery. But this is kind of, one day you had relatively manageable pain, and then within a day or so or a couple of days, you have extreme, severe new onset of pain, new onset of swelling that doesn't seem to be subsiding with anything. The next thing you want to look out for is increased difficulty with weight bearing. So increased difficulty with walking, with standing, with going up and down stairs, just having an increased difficulty, increased pain, increased instability with these weight bearing tasks. The knee replacement itself and the knee itself might just feel loose, and it might feel like it wants to give out or it wants to buckle suddenly. And this is something common, again, with the rehab process as you build up your strength, but it might be kind of this new onset of just feeling like the knee is really loose, feels like it's going to buckle and give out. Also, new signs of redness or warmth. Of course, again, very common after surgery, but maybe months or so after surgery or longer, you find this new onset of redness and warmth around the knee joint. Or possibly new noises. You hear a clinking, clunking that you didn't necessarily hear before. So again, all of these things very normal, things to experience at some point in your rehab, but if you have these sudden new onsets of these symptoms. And then probably a big one also is a reduction in your range of motion. So you had a certain amount of extension and straightening, and then you had a certain amount of bending, and you were doing pretty good. And then all of a sudden, you've had this sudden decrease in how much you can bend, how much you can straighten your knee, probably some pain accompanied with it as well, and maybe a catching sensation, you might say. So what should you do, again, if you experience these symptoms? Again, contact your doctor's office right away. You can talk to your physical therapist too. They can give you some helpful advice, but reach out to your surgeon's office. If they are going to talk it over with you, have that consultation. If they want to take some imaging, if they want to do some further testing, then let them do that. Better safe than sorry, definitely in this situation. Now, if your knee replacement is loosened and there's a kind of a failure of the replacement, well, it kind of depends. If you're relatively young and relatively active still, then most likely the first option is going to be to try to have a revision knee replacement surgery. So go in there, take out the old implant, put in a new one, sew everything back up, go through the rehab process again, and have that new second knee replacement. If you're a little bit older, if you're someone who's not as active, possibly just kind of using conservative management, pain management strategies, rather than going through the risks and the intensiveness of going through a whole new revision surgery. And either way, you're going to have either some physical therapy and rehab as part of your conservative management, or if you're getting the revision surgery, you're likely going to have, or almost definitely going to have physical therapy and rehab afterwards as well. So I hope that gives you some good insight. I will say that it's relatively rare. The majority of people are not going to experience failure or loosening of their knee replacements over time, but it's definitely something that happens and something that you want to be aware of the possible signs of it. Even if you do have some of these signs, it's not necessarily that the knee replacement is loosened or is a failed implant, but it's definitely worth reaching out to your doctor and getting that consultation. So thank you very much for watching, everyone. Again, be sure to hit that subscribe button, leave your likes, leave your comments and questions below. I'll do my best to get back to you. Thank you.